series that is going to be on nerve muscle physiology. So up till now we looked upon general physiology. उसमें अगर आपको याद होगा cell transport, cell membrane, resting membrane potential, action potential, उसके properties. Those were the most key points or the key lectures जो हम लोग को करने था. ठीक है, अभी we are going to start with our nerve muscle physiology and let's get started with a case. So today we are not going to jump directly on the muscle because पहले हम लोग को थोड़ा सा nerve भी देखना पड़ेगा, है ना? So we are going to start with our case based, right? So read a case. Once you read the case, you will get more acquainted with what and how we have to study. Now this is a case that says that there is a 32-year-old, okay, a 32-year-old assistant who is complaining of blurring of vision, double vision. You can also add over here कि he is complaining of double vision or blurring of vision. There was difficulty in reading newspaper, there was difficulty in in walking, there was also leg weakness. Now very interestingly, you will see that these symptoms, they were relieved for some time and they again appeared. ठीक है, so थोड़े दिन तक ये symptoms रहे, उसके बाद ये symptoms बिल्कुल गायब हो गए और उसके बाद फिर से ये symptoms आने लगे उसको. And now he became conscious and he now thought that he should take an appointment to a neurologist. So जब वो neurologist के पास गया और जब उसका investigation हुआ तो पता चला कि there is a decrease in the nerve conduction velocity. Right? Now I may give you a diagnosis over here or I may not give you a diagnosis. This totally depends upon the examiner. So what is something which is causing difficulty in walking and then there is a decrease in the conduction velocity. Treatment given is beta interferon, or I may say you that he was advised MRI, right? And particularly, you know, these are middle-aged females. Middle-aged females it is more common, right? Now the questions related to it would be, what are the factors affecting conduction velocity? Physiologically, I can ask you, what are the factors affecting conductional velocity? Or I can ask you, how is there propagation of action potential in the myelinated or in the non-myelinated nerve fiber? How is there propagation of conduction velocity, propagation of action potential in the myelinated or in the non-myelinated nerve fiber? तो ऐसा कुछ question आ गया तो आपको clue बिल्कुल समझ में आ जाना चाहिए कि there is something which is related to a problem in the conduction velocity, and probably over here the answer is multiple sclerosis. Right? It is multiple sclerosis. So you must remember that multiple sclerosis is basically a demyelinating disease. Right? It is a demyelinating disease where there is loss of formation of the myelin sheath. There are antibodies, and because the myelin sheath is lost, there is a sensory conduction and motor conduction impairment, especially a sensory conduction. Okay, there is an impaired sensory conduction. Right? There is an impaired sensory conduction. So this is something important that is related to a case history which can be asked to you when we are speaking of nerve fibers. ठीक है, चलो, now we begin with our session. So nerve muscle physiology में when we start with nerve, the learning objectives are very specific over here. Initially, तो you must know the structure of neuron. Right? That means you should not only know the anatomical structure जो आप लोग anatomy में पढ़ते हैं, यहाँ पर you should also have the physiological functional way of knowing a neuron. Right? Axon का क्या function है, like that kind, and the other cells which are present, that is the neuroglial cells, what are the nerve growth factors, what are the type of the nerve fibers, what are the properties of the nerve fibers, what is the degeneration and the regeneration. And यहाँ पर what important question or a short note which we get is what is called as Wallerian degeneration. So Wallerian degeneration is something where very commonly you get questions upon, इस पर मिलते हैं आपको Wallerian degeneration पे questions मिलते हैं, and Wallerian degeneration पे even you get this thing, a short note और classification of nerve fibers तो वैसे ही important है, because clinically जब आप एक वाइवा देते हैं तभी भी important है, and when you are doing your practicals and there is clinical examination, CNS में जब आप करते हैं CNS में examination sensory system का, then also these things are asked. So by and large this is important. Also for MCQ it becomes important, MCQ के लिए भी it is important. ठीक है, so let's get started with the structure of the neuron and the other cells which are present. Now neuron is the structural and the functional unit of the CNS. It is the structural and the functional unit, and apart from that there are many other glial cells. Okay, there are many other glial cells. So we first start with the structure of our neuron. Okay, we will first start with the structure of neuron. Yes. So if you look into the structure of neuron, this is the cell body. You might have also studied in the CNS. So this is the cell body. The cell body is also called as soma. Okay, there is nucleus, but you must remember that there are no centrioles. Right? There are no centrioles. So because there are no centrioles, they do not show cell division. There is no cell division. This is something very important, that the cells do not show central cell division. But iske alawa there are very important this thing, very important organelles will be present over here. That means you will get numerous mitochondria, you will get Golgi apparatus. All these organelles will be present. Also what you get something very important over here, this you can see is what is called as the Nissel's granule or the Nissel's material. Structurally this is rough endoplasmic reticulum. ठीक है, इसमें क्या है, rough endoplasmic reticulum, या आप इसको बोलते हैं granular endoplasmic reticulum. And this is important because यहाँ पर there is an area, or this is the area where there is going to be synthesis of the neurotransmitter. ठीक है, यहाँ पर आपका क्या रहेगा, synthesis of neurotransmitter. Who is the neurotransmitter which will be released over it? Is acetylcholine. ठीक है, the neurotransmitter will be acetylcholine in the case of neurons, and they are basophilic structures. Okay, so when you look over, you should know that they are basophilic structures. Something very important is that there is, when you will study the degeneration and the regenerative changes, you get something which is called as chromatolysis. Chromatolysis. So what is chromatolysis? It is nothing but it is the degeneration of the Nissel's granule. Okay, it is the degeneration of the Nissel's granules, what is called as chromatolysis. Apart from this, when this degeneration can occur, it can occur, suppose there is injury. Okay, there is even some kind of poisoning, then also there can be degenerative changes, or that is chromatolysis of the Nissel's granule. Then you get something which is called as like this, neurofibrillary tangles. ऐसे मिलता है inside the cell. यहाँ पर you will get neurofibrils. Okay, neurofibrils, they form a loose meshwork. Now remember these neurofibrils in case of Alzheimer's disease. In case of Alzheimer's disease, what is Alzheimer's disease? Where there is memory loss, right? Where there is memory loss. So Alzheimer's disease may you get neurofibrillary tangles. Neurofibrillary tangles. ठीक है? So Alzheimer's disease where you get neurofibrillary tangles, right? Then the next part is these projections which are given out. These projections which are given out are called as dendrites. Okay, the projections which are given out are called as dendrites, and they are also called as the receptor zone. Receptor zone, because these dendrites will have these spikes. Okay, they will have knobby projections which are called as the dendritic spines. Okay, there will be knobby projections which are called as the dendritic spines, and these dendritic spines are actually the site where there is going to be reception, or it is going to receive the inputs from other cells, the local potentials. It is going to receive the local potentials. So it is the receptor zone, right? अगर आप बोलेंगे कि what is dendrite, physiologically dendrite is the receptor zone. Now you get this conical portion which is called as axon hillock. Okay, the conical portion which is called as axon hillock. Axon hillock के बाद में ये वाला first portion is called as initial segment. Initial segment. ये दोनों ही जगह पर you will see that there is no myelin sheath and even there are no Nissls granule. वहां पर myelin sheath भी नहीं है और Nissls granules भी नहीं है. What is the importance of this axon hillock as well as the initial segment? इसका importance ये है कि these are the sites of generation of propagated action potentials. These are the sites of generation of propagated action potentials. मतलब जो action potentials eventually propagate होंगे via the axon, they are going to be generated at the axon hillock and the initial segment. What is the reason? The reason is that these two areas have got least threshold for excitation. Okay, these two areas have got least threshold for excitation. What is the reason? यहाँ पर there are large number of sodium channels. Okay, there are large number of sodium channels. So the action potential which is supposed to be propagated, वो कहाँ पर बनेगा? वो यहाँ बनेगा. That is in the axon hillock and the initial segment. Right? Now this is the axon. Okay, this is the axon. What is the role of axon? The axon is going to propagate your action potential, right? The axon is going to propagate your action potential. So what is the role of axon? The axon is going to help in the propagation of action potential. Now you can see that यहाँ पर in this case it is covered by myelin sheath. Right, so in the myelinated nerve fibers you will get the myelin sheath, and myelin sheath में there is going to be a constriction in between where there is no myelin sheath, which will be the nodes of Ranvier. Okay, which will be the nodes of Ranvier. और जो non myelinated है उसमें कोई nodes of Ranvier आपको नहीं मिलेंगे. It will be simply non myelinated nerve fiber. Right, so the end of this axon. Okay, finally the end of this axon. How is the end of axon? See this, the end of the axon is in the form of synaptic knobs. They're also called as synaptic terminals. Okay, synaptic knobs or synaptic terminals which store the neurotransmitter substance, that is acetylcholine. Right, so this is the structure of neuron. So again we'll see over here. देखो. So first, this is the receptor zone. Receptor zone are the dendrites and the dendritic spines, which are the area where there is going to be the receiving of the non-propagated local potentials. Right? Now you are going to integrate them, algebraic summation, plus minus. So that integration is going to be in the soma. Finally, the initial segment and the axon hillock. Okay, the axon hillock and the initial segment, they are going to be the site which are going to propagate, or which are going to generate the propagated action potentials, which are going to be transmitted by this axon depending upon whether it is myelinated, whether it is non-myelinated. It ends in the form of synaptic knobs or terminals or buttons which store secretory vesicles which contain the neurotransmitter, that is acetylcholine. Okay, so first is this initial segment on the axon hillock where there are maximum sodium channels. But remember, another site where there are very rich sodium channels are the nodes of Ranvier. Nodes of Ranvier, maybe there are large number of sodium channels, and then later on we will see that what is the role of this large number of sodium channels which are present here, right? So you should be able to understand physiologically कि ये सब क्या क्या है, what are the different types of the what is the physiological way of knowing a neuron. Now you have got different cells in the neurons which are called as the neuroglial cells. Now remember, the neurons, they are supported, okay? These neurons are supported by glial cells. And obviously the number of the glial cells will be more than neurons. Okay? The glial cells will be more than neurons. Very importantly, this glial cells, they undergo cell division. जैसे कि न्यूरॉन्स तो सेल डिविजन नहीं दिखाते हैं, है ना, बट the glial cells, they undergo cell division, and that is the reason that why most of the glial cells or the brain tumors, they are coming from the glial cells. The brain tumors, they come from the glial cells because the glial cells, they have got a capacity of cell division, right? Now, so you can see the cells have got ependymal cells, astrocytes and oligodendrocytes. ये सारे cells हैं हमारे पास. So first, very important are the astrocytes. These astrocytes are of two types, fibrous and protoplasmic. Fibrous and protoplasmic. Fibrous are present more in the white matter, whereas protoplasmic are present more in the gray matter. Right? The fibrous are present more in the white matter, whereas the protoplasmic are present more in the gray matter. Now, what do they do? So there are lots of functions which are carried by these astrocytes. Both of them, they send out long processes, okay? They send out long processes that overlap the outer surface of capillaries, that overlap the outer surface of capillaries. They contribute to the formation of the blood-brain barrier, okay? They contribute to the formation of the blood-brain barrier by inducing the formation of tight junctions. By inducing the formation of tight junctions. So first important function of the astrocyte is that they help in the formation of the blood-brain barrier, right? Then another very important function is, you know, that they keep up or they maintain the potassium levels, right? They maintain the potassium levels. So they can pick up potassium ions. Potassium ions. Second is they can also pick up glutamate. So they take up glutamate and they convert this glutamate into glutamine. Right? What are they doing? They can take up the glutamate and convert them into glutamine, and this glutamine is then transferred into neurons. Okay? The glutamate is converted to glutamine. Glutamine is transferred into the neurons, and in the neurons it will be again secreted in the form of glutamate. And you know that what is glutamate? Glutamate is an excitatory neurotransmitter, right? So they are converting the glutamate into glutamine, giving this form into the neurons, and the neurons will secrete it again in the form of glutamate, and you should remember that it is an excitatory neurotransmitter. Now something very, very important, you must know that they are not producing any action potential. They are not producing any action potential, and they can also take up glucose. So apart from taking up the the potassium and the glutamate, they can also take up glucose. What they will do, they will convert this glucose into lactate. This lactate will be released by the astrocytes, and then it will be used in the form of energy. Okay, it will be then used in the form of energy. And finally, they also play an important role in formation of synapses in the CNS. Formation of synapses. So this is also a part of neuroanatomy. Well, in physiology, we basically concentrate on the functions rather than on the structure and all, right? So we've seen astrocytes. Then the next important cell are your oligodendrocytes. So what is the function of oligodendrocytes? See, oligodendrocytes are involved in the formation of myelin sheath in the CNS, whereas in the peripheral nervous system, this myelin sheath is formed by the Schwann cells. Schwann cells. And you must remember that the Schwann cells, they can, when they whirl around, या जब वो cells के आजू बाजू घूम रहे हैं in case wrap कर रहे हैं और myelin sheath बना रहे हैं, they're only going to one at a time, they're only going to serve one cell at a time. But जो oligodendrocytes होते हैं, बहुत सारे nerve cells को they can wrap and they can simultaneously form the myelin sheath. So they can, they can myelinate several nerve fibers or the nerve cells. They can myelinate several nerve cells simultaneously, एक ही साथ. But ये क्या करेगा Schwann cell? One at a time, right? One at a time. Then the next important cells are your microglial cells. So these microglial cells, though they are a part of the CNS, remember they are derived from bone marrow. They are derived from bone marrow and they are actually behaving as macrophages. So they are supposed to be the defense cells of your nervous system, right? Defense cells of your nervous system. And finally, you have got ependymal cells. These ependymal cells, they are known to line your ventricles and also the cavity of the spinal canal, right? They are known to line the ventricles as well as the cavity of the spinal canal, and their function is to secrete CSF. Plus they also have got cilia. They also have got cilia. So they will also help in the movement of the circulation of the CSF. Right? Circulation of CSF. So just a table, right? So that you can just go through. If you are following, you can just write down. जब आपको आंसर आता है ना एग्जाम में, तो आपको ऐसा लिखना चाहिए. You are expected to find a table out of it, so that फटाफट you can just be pleasing to the examiner also who is correcting. So you've got astrocytes, you've got microglial cells, you've got oligodendrocytes and ependymal cells. Astrocytes, we've just seen formation of the blood-brain barrier, taking up excess of potassium. It is important for synapses. It also provides a physical support to the neurons, reuptake and recycling of the neurotransmitters, and it can also synthesize nerve growth factors, that is neurotrophins. Okay, it can also synthesize the nerve growth factors, that is neurotrophins. Ependymal cells, we've seen they secrete CSF. Oligodendrocytes, they form myelin sheath, and microglia are the defense cells of the CNS. In the peripheral nervous system, you have got the Schwann cells, which play a very important role in formation of the myelin sheath in the peripheral nerves. They can also synthesize neurotrophins, and you must remember that they also help in insulation and protection of the neuromuscular junction. Insulation and protection of the neuromuscular junction at skeletal muscles. Okay, so this is regarding the structure of the neuron and the various neuroglial cells which we have, because you can get a short note over this. Now let's move forward. To the next important part, that is axonal transport. Okay. Now you see that there are two types of axonal transport. So axons play very important role. First is propagation of the action potential. Second is the transport, because you are going to synthesize at the level of cell body and you will have to transfer them all the way to the axon terminal. और कुछ चीजें ऐसे होगी जो आपको रिसाइकल करके वापस सेल बॉडी में लेके आना पड़ेगा, है ना? So you require a conduction pathway. So you can see over here that that there are two types of the axonal transport which we get. First is the antegrade and second is the retrograde. You get two types of axonal transport. So first is this, that is all the way from the cell body towards the terminal, right? This is called as antegrade. And the other one is retrograde, like this, retrograde, that goes from these synaptic terminals to the body, to the cell body, right? Now they require specific proteins, and the proteins are a part of your MCQ. For example, you can see that this is dynein, which is required for retrograde transport. Ulta, that means from the axon terminal towards the cell body. This retrograde transport mainly helps in carrying the recycled empty secretory vesicles. Recycling of the empty secretory vesicles. The vesicles, once the neurotransmitter is released, they're going to be recycled, so they're going to be taken back to the cell body. But very important is, it can pick up neurotropic viruses. Neurotropic viruses. For example, there is dog bite. Dog bite mein what is released will be the rabies virus. Okay. That virus is going to go all the way from the periphery to the CNS using this retrograde transport. Also tetanus toxoid. Tetanus का जो toxin है, वो toxin, there is an injury, there is Clostridium bacteria, there is Clostridium, the tetanus toxin that is produced, it is going to go all the way up to the CNS through this, right? Therefore, this becomes important. Now, yes. Now we move ahead. Now the next topic which we will consider will be our properties of nerve fibers, or you can even go for the classification of nerve fibers. 1 minute. Yes, we can also begin with the classification of nerve fibers. अब देख पूरा फिर री रिकॉर्ड करूं. हाँ ये वाला, हाँ ये वो हो गया, वो यहाँ पर थी मैं रिट्रोग्रेड ट्रांसपोर्ट पे, करेक्ट। चलेगा, स्टार्ट कर दूँ मैं हूँ, चल बेटा, ओके थैंक्स। Okay, so you can see over here that you have got axonal transport. Now this axonal transport can be a retrograde transport or it can be a antigrade transport. So antigrade transport will take the things all the way from the cell body towards the end of the axon terminals, okay, towards the end of the axon terminals, and that requires a protein that is called as kinesin. तो ये आपका MCQ बनता है. It requires a protein that is kinesin. So what is kinesin? Kinesin is a protein that helps in antigrade transport. That means taking the substances all the way from the cell body to the axon terminal. Then the other one is retrograde. Retrograde क्या करता है? From the terminal it takes all the way to the cell body, right? Now this is very important because it is going to take up the recycled or the empty secretory vesicles. Once the vesicles have released their contents, वो empty हो जाएंगे, तो उनको recycle करके वापस आप cell body की तरफ लेके जाओगे. That is retrograde. Apart from this, this is also very important in taking up neurotropic viruses. Neurotropic viruses, that is like rabies, okay, or even the tetanus toxin. It reaches all the way and brings about symptoms related to central nervous system, and that is mainly brought about by this kind of transport, and therefore this transport is important. So axonal transport, it can be fast as 40 mm per day or it can be slow to 0.5 to 10 mm per day. Retrograde is at the rate of 200 mm per day. Okay, so this is the axonal transport, right? Now the next we will cover something very important topic, that is classification of nerve fibers. This topic is a very high yielding topic because this is the topic that is rich in MCQ. तो मैक्सिमम जो MCQ आ सकते हैं ना हमको, वो इस पर से आते हैं, right? So you have got the classification which we called as the Erlanger and Gasser's classification. Okay, you called it Erlanger and Gasser's classification, and there is also a numerical classification. So this first classification where there is alpha, beta, gamma or A, B, C, this is called as the Erlanger and Gasser's classification. Now remember, this classification is going to analyze both the sensory and the motor functions of the nerve fiber, right? It is going to address both the sensory and the motor functions of the nerve fiber, sensory bhi or motor bhi, right? So it has principally classified the nerve fibers depending upon their diameter and conduction velocity, right? Depending upon their diameter and conduction velocity into A, B and C. So maximum diameter is A fibers. Maximum diameter is A and subsequent diameter is type C. So the first MCQ, what are the fibers which have got least conduction velocity? Okay, or which fibers have got least conduction velocity? The fibers which have got least conduction velocities are type C because उनका diameter सबसे कम है. फिर आप second बात याद रखो that type A fibers are myelinated, type B fibers are myelinated, but the type C fibers are non-myelinated. ठीक है, the type C fibers are non-myelinated. So as soon as the fibers are non-myelinated, ठीक है, जैसे आपको समझ में आ गया, the fibers are non-myelinated, the conduction velocity will be least. So remember A, B, C, where A is myelinated, B is myelinated and C is non-myelinated. And if you look into the diameter, maximum diameter is of A and therefore it will have maximum conduction velocity. Now, how to remember what sensations are carried by what fibers? ये बहुत ही हम लोगों को मुश्किल लगता है फर्स्ट एमबीबीएस में. तो हम लोग चालू करेंगे टाइप बी से. टाइप बी is what it is, preganglionic autonomic fibers. Preganglionic autonomic means what? Sympathetic and parasympathetic fibers before they have synapsed in a ganglion. For example, see, this is the spinal cord, and from here the nerve fibers will originate, or they will originate from some kind of the brainstem nuclei. This is going to be a ganglion where they will synapse, and then after that these are the fibers. So before the synapse they become preganglionic fibers, and after the synapse they become postganglionic fibers, है ना? Before the synapse preganglionic fibers, after the synapse postganglionic fibers. ठीक है? तो जो सारे प्रीगैंग्लियोनिक फाइबर्स है, ऑटोनॉमिक मतलब सिंपैथेटिक या पैरासिम्पैथेटिक, प्रीगैंग्लियोनिक फाइबर्स सिंपैथेटिक और पैरासिम्पैथेटिक, दे आर कैटेगराइज्ड एज टाइप बी. सो जब भी आप ऑटोनॉमिक नर्वस सिस्टम पढ़ेंगे और आपको एक वर्ड सुनाई देगा प्रीगैंग्लियोनिक, आपको ध्यान रखना है दे आर टाइप बी फाइबर्स. सो if there is something which is preganglionic, then there is going to be something which is postganglionic. So who is postganglionic? Type C fibers. Type C fibers are postganglionic, and type C also carries some other sensations, that is pain and temperature. If you can remember very precisely, remember slow pain. Okay, if you can remember very precisely, remember slow pain. ठीक है? So we've seen type B, we've seen type C. The next is our type A fibers. Type A fibers are classified into alpha, beta, gamma, delta depending upon again their diameters. Alpha का diameter सबसे ज़्यादा है 12 to 20, then beta 5 to 12, gamma 3 to 6 and delta 2 to 5, and accordingly उनके conduction velocities भी कम होते जाएंगे. Right? अब हम याद कैसे रखेंगे? पहले हमने देखा प्री गैंग्लियोनिक, फिर हम आए पोस्ट गैंग्लियोनिक पे. देन वी सॉ पेन एंड टेम्परेचर, एंड आई टोल्ड यू स्पेसिफिकली कि आप याद रखो स्लो पेन. इफ देर इज समथिंग विच इज स्लो पेन, दैट मीन्स देर इज समथिंग विच इज फास्ट पेन. सो फास्ट पेन इज कैरीड बाय ए डेल्टा, फास्ट पेन एंड टेम्परेचर. ए डेल्टा डन. नाउ ए गामा हैज गॉट motor innervation to muscle spindle. Okay, A gamma has got motor innervation to muscle spindle. You can also remember intrafusal. आपको ये टर्म इंट्राफ्यूजल बाद में बहुत काम आएगी जब मैं आपको मसल स्पिंडल पढ़ाऊंगी. सो ए गामा मोटर टू द मसल स्पिंडल, राइट. देन ए अल्फा proprioceptive impulses and somatic motor. Somatic motor means it is motor to the skeletal muscles. It is motor to the skeletal muscles, and you can remember A alpha also as extrafusal. It supplies the extrafusal muscle fibers. Okay, it supplies the extrafusal muscle fibers. And sensory component, proprioceptive impulses. Okay, the sensory component, it is the taking care of the proprioception. So this is Erlanger and Gass's classification mixed nerve के लिए. Okay, then there is this classification which is taking only the numerical classification, which is purely the sensory classification, Lloyd and Hunt classification. Lloyd and Hunt classification. This classification only takes into account the sensory component. So according to this, the A alpha fibers, that means the diameter of the A alpha fibers and the conduction velocity of the A alpha fibers is same as 1A and 1B. But again, the sensory classification will only consider the sensory function. A beta and A delta, they have got the diameter and the conduction velocity same as type 2. Type C of the Erlanger, which is type C non-myelinated. Okay, type C non-myelinated, it is same as type 3. And A delta is type 4. इसका मतलब the features which is of the A delta are same as type 4. the features of A beta same as type 2, that you have to remember. ऐसे इसका मतलब होता है, मतलब जो जिस तरीके का उनका डायमीटर है या जो उनका कंडक्शन वेलोसिटी है, that comparison is done. So 1A muscle spindle, okay, 1A supplies muscle spindle, 1B Golgi tendon organ. Type 2 also supplies your muscle spindle. Type 2 also supplies your muscle spindle. Type 3 carries the fast pain and cold, like fast pain and cold. Okay, 1 minute. Just let me, there's some, Type C. Okay, this is, 1 minute, I'll just write down this. I don't find this very apt. 1 minute. Yes. Now, 1A, which is same as A alpha. 1A, which is same as A alpha, it is supplying the muscle spindle. Muscle spindle, and it is called as the annulospiral ending. Annulospiral ending. 1B, which also has got features same as A alpha, supplies the Golgi tendon organ. Okay, it supplies the Golgi tendon organ. Then you have got A beta, which is type 2. Sensory numerical classification ka type 2 has got same features as A beta, which is taking your touch and pressure sensations. Touch and pressure sensations, but it also carries touch and pressure sensation, but it is also supplying your muscle spindle. That means muscle spindle has got two innervations, two afferents, 1A and type 2. Then you have got A gamma, which is only motor to the muscle spindle. Motor to the muscle spindle. सो ए गामा जो है, जो मोटर टू द मसल स्पिंडल है, उसको हमने कोई भी न्यूमेरिकल क्लासिफिकेशन 1 2 3 4 नहीं दिया हुआ है. वी हैव नॉट गिवन ए गामा एज एनी ऑफ द न्यूमेरिकल नंबर्स, रोमन लेटर नहीं दिया, बिकॉज ए गामा क्या था, मोटर टू द मसल स्पिंडल. ठीक है. और हम लोग जब सेंसरी क्लासिफिकेशन की बात करते हैं लॉयड हंट की, वहां पर वी आर नॉट टेकिंग इनटू कंसिडरेशन द मोटर एस्पेक्ट, ओनली द सेंसरी. Type C, okay, type C is type 4 type of fibers is type C, okay, type C is type 4 and A delta is type 3. A delta is type 3. So type 3, that is A delta, will carry fast pain and cold temperature, whereas type 4, which is type C of Erlanger, will carry slow pain and temperature. It carries basically both temperatures, cold as well as hot. Okay, cold as well as hot. So is it clear now? We've got two classifications. We've got two classification, Erlanger and gaseous classification. A, B, C. B preganglionic autonomic, C postganglionic and pain and temperature, especially slow pain. A alpha beta gamma delta, we started with A delta, that is fast pain and temperature. A gamma, which is motor to the muscle spindles, and I told you to remember A gamma को intrafusal supply. A alpha extrafusal muscles को supply करेगा, skeletal muscles को, plus proprioception. And A beta carries touch, pressure. Okay, these type of sensations. And we have got a numerical classification. The numerical classification which we have given is 1A, 1B, type 2, 3 and 4. Okay, so 1A, 1B, type 2, 3 and 4. Remember, A gamma को कहीं पर भी there is no number, no Roman number being given, क्योंकि A gamma is motor and Roman numbers वाला जो हमारा classification है, it only takes into account the sensory classification and not the motor classification. Right? Now, so see, there is one interesting MCQ. A person is sleeping on arm. Okay, a person is sleeping on arm and experiences paresis, matlab weakness in the morning. Suppose you are sleeping and keeping this arm under your head, and in the morning you find some numbness and it immediately vanishes. कुछ उसके बाद हो नहीं रहा, it is immediately गायब after some time. So the best explanation is which type of fibers are maximally susceptible to pressure. So A fibers are maximally susceptible to pressure. So to pressure, it is the A fibers which are maximally susceptible, and to hypoxia, it is the type B fibers which are maximally susceptible. Okay, A fibers to pressure and type B fibers to hypoxia. Now, what are neurotrophins? Neurotrophins are also called as the nerve growth factors. Nerve growth factors. These are the factors which are required for the optimal growth as well as survival of the neurons. Okay, they are nerve growth factors. Then there is brain derived nerve growth factor or the brain derived neurotrophic factor, and even neurotrophin 3. They are transported by exoplasmic flow towards the endings, right? So there are certain neurotrophins which are coming from the neuronal soma, that means from the cell body. So some of the neurotrophins which are coming from the cell body, they will be transported by the exoplasmic flow towards the terminal endings. But there are some which are formed by the astrocytes and by the muscle cells. They are going to bind to their receptors which are present on the nerve endings, and they are going to be transported retrogradely towards the soma. That means there can be certain neurotrophins which are going to be formed by the cell body itself, and there are going to be certain neurotrophins which are going to be formed by the astrocytes and the muscle cells. So, जो neurotrophins will be formed by the soma, they will take antegrade transport, and those which are formed by the muscle cells or which are formed by the astrocytes, they will be taken up by retrograde transport. Okay, what is the function? They play a very important role in the neuronal growth and development, and very important to maintain the integrity of the postsynaptic neuron, right? And they also help in the survival of the central cholinergic neurons because they have got the capability of inhibiting apoptosis, right? So these, they come as a form of short note neurotrophins, that is brain derived growth factors. Now let's start with the properties of the nerve fibers. So this is in the form of a table I have given you, but it is very important for us that we must understand first. Okay, so what are the different properties of the nerve fibers? Now see, many of the properties of the nerve fibers are same as that of the action potential. So once you have understood the action potential, I don't find that there is much difficulty in understanding the properties of the nerve fibers. So first important property is excitability. Excitability. What do you mean by excitability? This means that it will respond, okay, it will respond to a stimulus. Stimulus which can be electric, it can be thermal, it can be a mechanical stimulus. So the ability to respond to a stimulus is what is called as excitability. And again, remember, there should be a threshold stimulus to elicit action potential. Okay, there must be a threshold stimulus to bring about action potential. Second, if you also remember, कल हम लोगों ने chronaxy पढ़ा था, right? We have studied chronaxy. So excitability is going to be measured in terms of chronaxy. And I have told you that the nerve fibers or the neurons have got least chronaxy because they are most excitable. Okay, they have got least chronaxy because they are most excitable. Then all of these exhibit resting membrane potential, that is around -70 millivolts. So we yesterday considered the topic of resting membrane potential. So resting membrane potential is not only the feature of the skeletal muscle or the cardiac muscle, it is also the feature of neuron. And their RMP is -70, and we've also considered the various mechanisms by which we can study the find out the RMP. Then they also show latent period. That is the time lapse between the application of stimulus and the response. Okay, time lapse between the application of stimulus and response that is given by the nerve fiber. Okay, the response that is given by nerve fiber. Now these also can show a local response. When they will show a local response, they will show a local response when you give a subthreshold stimuli. Right, subthreshold stimuli. So they will give a local response when you give a subthreshold stimuli, right? So the amount of depolarization that will be produced will depend upon the intensity of the stimulus. If the intensity of the stimulus is good, then what will happen? There will be propagation of the action potential because it will be generated with full magnitude. Otherwise, limited local response rahega, and it can die off also because the local responses are non-propagatory. Then obviously there is action potential. This action potential will be produced only when you are giving a threshold stimuli, and it is going to be a kind of a spike potential, right? It is going to be a kind of a spike potential, right? And again remember the same properties, that is non-decremental, of same magnitude, non-decremental, of same magnitude, that is there. Then these also exhibit all or none law. Right? They also show all or none response. That means if you give a threshold stimulus or a supra-threshold stimulus, the response will be given will be maximum or no response. Right? The response will be given maximum or no response will be there. And they also exhibit refractory period. So yesterday itself we have seen that what is refractory period. That means the action potentials जो होते हैं, right, जो action potentials होते हैं, जो उनकी properties है, almost all of these are exhibited also by your neuron or the nerve fibers. They also show refractory period. Now next very important property is what is called as accommodation. What is accommodation? Accommodation का मतलब क्या होता है कि there is a kind of adaptation to a stimuli, right? There is a kind of adaptation to a stimuli. So we'll just try to understand this nicely, you know, what do you mean by adaptation to the stimuli, or what is this kind of accommodation which is called as. Now see, if you are giving a subthreshold stimulus, okay, if you are giving a subthreshold stimulus, or even if you are giving, you know, a stimulus which is for a longer duration, but it is subthreshold, right? Or you are slowly giving a stimulus. Now, so basically when you give a stimuli which is a very slow developing stimuli, very slowly you are stimulating, or it happens to be a subthreshold stimuli. So when you give a stimuli, that means you're bringing about a change in the membrane potential. So you're going to open the fast voltage gated sodium channels, and eventually the sodium channels will close and there will be opening of the potassium channels. And you know that the potassium channels are slow to open and they remain open for a longer time. So ideally क्या होगा, fast sodium channels खुलने चाहिए, सोडियम अंदर आएगा, फिर चैनल्स बंद हो जाएंगे, पोटेशियम चैनल्स खुलेंगे और repolarization होएगा. Now when you are giving very slowly and it is also subthreshold, you are opening the sodium channels, right? But the stimuli is continuous and it is slow. So what happens that you open the sodium channels, but these sodium channels are not able to release sufficient or does not bring about a sufficient amount of sodium influx, because within that slowness, when you are not able to create a good depolarization, the inactivation gates of the sodium channels, they close. So by this kind of stimulation, the inactivation gate of the sodium channels are closing, and at the same time you bring about opening of the potassium channels. तो आपको क्या चाहिए when you want to bring about an action potential? There should be opening of the sodium channels for a sufficient time. But यहाँ पर क्या हो रहा है कि the opening of the sodium channels is not for a sufficient time, right? There is closure of the inactivation gates of the sodium channels, rather there is opening of the potassium channels. So the sodium is not coming inside adequately, but the potassium is going out, and you do not get an adequate amount of sodium. Therefore you are not able to produce an adequate or a action potential of the magnitude which is required. Okay, you are not able to produce the action potential which is required. So the sodium channels का जो threshold है वो arise ही नहीं होता है. There should be arrival of a threshold, right? So that threshold is not arrived. So sodium channels, they open. As they open, the inactivation gates, they close, because वो बहुत slow है, वो long duration का है, वो सब threshold है, और potassium भी खुल जा रहे हैं. So ultimately sodium भी अंदर नहीं आ पा रहा है, right, adequate amount में, और potassium बाहर चला जा रहा है. So it is going to result in inadequate amount of sodium availability. The nerve is not getting response, or it is not showing response, and you called it as a property of accommodation, right? You called it as a property of accommodation of the nerve fiber, right? Then the next very important property is what is called as propagation. Propagation, or how is the conduction of this action potential, or how is the property of conduction velocity. So यहाँ पर when we speak of the conduction velocity, there are two things to be considered. How is the conduction velocity in the myelin sheath, that means the myelinated nerve fibers, and how is the conduction velocity in the non-myelinated nerve fibers. दोनों में हमको देखना पड़ेगा. Obviously myelinated nerve fibers में the conduction velocity is going to be faster. Now in the non-myelinated nerve fibers, see, this is the initial condition of the nerve fiber, that inside it is negative. Okay, initially inside it is negative and outside it is positive. ऐसे ही होता है ना, inside negative, outside positive. This is what is the polarized state or the RMP. Now suppose you gave a stimulus. Okay, आपने stimulus दिया यहाँ पर, तो इसकी polarity change हो जाएगी. अंदर से it will now become positive and बाहर से now it is negative. That means the polarity has reversed. Okay, polarity has reversed. लेकिन अभी भी जो इसके बाजू वाला एरिया है, जो नेबरिंग एरिया है, वो अभी सेम है. मतलब यहाँ से नेगेटिव, बाहर से पॉजिटिव, यहाँ से नेगेटिव, बाहर से पॉजिटिव, और यहाँ पर आपने स्टिमुलस दिया. So when you are giving a stimulus, there is going to be a transfer of charges from the depolarized state to the adjacent non-depolarized state. There is going to be a transfer of charges from the depolarized state to the adjacent non-depolarized state, forming these circular whorls which are called as the current sink. Okay, something which is called as current sink. So what is happening is that there is a current sink which is going from this area where you gave a stimuli to the surrounding area where there is no stimulus yet. तो बाजू वाले अभी भी negative positive polarized जैसे हैं. So ऐसे ऐसे क्या होता है कि this will then continue. Okay, this will then continue. So there will be passage of the current sink. So every depolarized area will now depolarize the neighboring area. Once this area is depolarized, a current sink will be formed and depolarize the neighboring area. But action potential, it actually propagates both backwards and forward. backwards and forward from the point of stimulation, right? It moves both backward and forward from the point of stimulation. But when we speak of a propagated action potential, the propagated action potential will never spread backward. It will never spread backward. Why it will never spread backward? Because that backward area goes into refractory period. So that is the significance of the refractory period. That refractory period helps in the propagation of the impulses only in the forward direction. पीछे पीछे नहीं जाता है, आगे ही जाएगा, right? So the action potential will only propagate in the forward direction. Only propagate in the forward direction, never in the backward direction, because the backward direction it undergoes or it goes into refractory period, right? So remember the point of stimulus, जैसे जहां पर हमने स्टिमुलेट किया उसकी पोलैरिटी चेंज हो जाएगी, अंदर से पॉजिटिव और बाहर से वो नेगेटिव हो जाएगा. दिस विल रिजल्ट इन द ट्रांसफर ऑफ द चार्जेस इनटू द नेबरिंग एरियाज, आगे और पीछे, राइट? एंड इट दे विल फॉर्म करंट सिंक. पीछे वाला एरिया भी हमने थोड़ा सा डिपोलराइज किया, लेकिन कभी भी वहां पर एक्शन पोटेंशियल प्रोपेगेट होने वाला नहीं है, बिकॉज दैट एरिया गोज इनटू रिफ्रैक्शन. सो एक्शन पोटेंशियल विल ऑलवेज बी प्रोपेगेटेड अहेड और इन द फॉरवर्ड डायरेक्शन. दिस इज इन द केस ऑफ myelinated nerve fibers. Now you can see, non-myelinated nerve fibers. Now in the case of the non-myelinated nerve fibers, these ionic changes are taking place through the entire length of the nerve fiber, because you are opening and closing the channels and you are restoring the channels using the sodium potassium ATPase pump. So it is consuming more energy and the conduction velocity will be lesser. What will happen when you speak of the myelinated nerve fibers, or how the conductivity is going to change? So this is the nerve fiber which is myelinated. Okay, and there is myelin sheath. Myelin sheath has got break of these constrictions which are brought about by the nodes of Ranvier. Remember, the nodes of Ranvier has got very high amount of, the nodes of Ranvier have got very high amount of sodium channels. बहुत सारे sodium channels रहते हैं उसमें. And the myelin sheath is how? It is insulating. That means it is not going to allow the current to pass through it. So अगर अब current को pass करना है तो ये वाला उसको छोड़ना पड़ेगा. It has to jump. So this jumping is called as saltatory conduction. Right? The jumping is called as saltatory conduction. So the conduction of the nerve impulse will take place only from one node of Ranvier to the next node of Ranvier, right? And you are going to open and close the channels only at the level of nodes of Ranvier, and nodes of Ranvier have got a very very high concentration of sodium ions. So this jumping के वजह से क्या हो रहा है? The ionic changes and the utilization of the sodium potassium pump to restore the ionic balances is taking place only at the level of the nodes of Ranvier. So ultimately what you are doing is you are using less energy, but the conduction velocity is faster because of jumping. You are not you are not traveling through the entire length. You have to jump. So less energy and conduction velocity is going to be faster. What does myelination do? Myelination increases the diameter of the nerve fiber. And when we speak of physics, it basically increases the membrane resistance. It decreases the exoplasmic resistance. Okay? It increases the membrane resistance, it decreases the exoplasmic resistance and it also decreases the membrane capacitance. So when you are decreasing the exoplasmic resistance, मतलब क्या होता है? The current can easily flow through the exoplasm. And because you have increased the resistance of the membrane, the current cannot flow across the membrane. So the current is now has to flow. The current is made mandatory. Current को अब flow करना है सिर्फ ऐसे जगह पर जहाँ पर membrane है ही नहीं. That is nodes of Renville. And when you decrease the membrane capacitance, basically you also decrease the leakage of the current across the membrane. So you are not allowing the leakage of the current across the membrane, right? You are not allowing the current to pass through the membrane, but only through the exoplasm. So myelination brings about these physics changes and increasing the conduction velocity with less energy. And it is called as saltatory conduction. And you must remember that how the myelin sheath is being formed. यहाँ पर थोड़ा सा आपको पता होना चाहिए कि how the myelin sheath is being formed. So we've seen that the myelin sheath in the CNS is by oligodendrocytes, but in the peripheral nerves it is with the help of Schwann cells. Right? It is with the help of Schwann cells. So what will the Schwann cells do now? These Schwann cells. So this is the nerve fiber or the nerve cells, and what will happen, these Schwann cells will go on wrapping the nerve fiber like this. So the Schwann cells, in the case of non-myelinated nerve fibers, the Schwann cells will only form one wall or a single layer. But where there has to be myelination, they are going to form several layers or multiple layers. They are just going to curl around and around and around the nerve cells and make it myelinated. Right? So myelination से क्या होता है वो भी आपको ध्यान रखना है. What changes take place, and myelination is going to result in conduction velocity, which is called as saltatory conduction velocity. As far as myelination is concerned, remember that myelination जो होता है ना, myelination, it starts right from the 4th month of intrauterine life. Okay, myelination begins in the 4th month of intrauterine life, and at birth maximum myelination is completed, but the pyramidal tracts का myelination complete नहीं होता है. The pyramidal tracts का myelination is completed when the child starts walking, running, that is about the age of 2 years. And therefore before 2 years you will study something that is in CNS we will study, which is called as Babinski's sign. Positive is a feature. Babinski's sign, positive is a feature up to 18 to 24 months, and that is quite obvious. What is Babinski's sign? Suppose this is the foot of the baby and you give a lateral stroke. When you give a lateral stroke, normally there should be plantar flexion of the toe and the toes का ऐसा plantar flexion होना चाहिए. This is normal plantar response. लेकिन छोटे बच्चों में you will get fanning of the toes or an extensor response. What is the reason? The myelination of the pyramidal tracts is not completed, and therefore you will get extensor response. But अब याद रखना कि अगर ये extensor response आपको adults में मिलता है, okay, अगर ये extensor response आपको adults में मिलता है, that means Babinski is positive in adults. It is not physiological. That means there is some error or some problem with the upper motor neurons, or the upper motor neuron का lesion है. So at this point don't put much of your brain, but remember this topic will be considered more when we start our CNS. और तब आपको ये बात को याद रखना है कि myelination begins in the 4th month of the intrauterine life. Sensory tracts are myelinated. Therefore the bachcha can easily feel the sensation of touch when he is born. But the pyramidal tract का myelination takes up to 2 years. So you can get a positive Babinski's sign by 18 to 24 months of a child. Right? So What have we completed up till now? We've seen the classification of, we've seen the structure of the nerve fibers, neurons. Then the other neuroglial cells we've looked upon. Then properties of the nerve fiber we saw. Today, new property we learned was conduction velocity in myelinated, non-myelinated, and accommodation. Rest of the properties were same as that we covered with the, which we covered with the help of our, the action potential. Then you must, apart from the properties, the classification of nerve fiber. Classification of the nerve fibers are very, very important topic, very important topic. So you must remember the classification of the nerve fiber nicely, right? MCQ के लिए it is very important. And now we will look into the next topic, that is the degeneration and the regeneration of the nerve fibers. Again, उस पर भी short note आता है, degeneration or regeneration of the nerve fibers पर भी you get a short note. So again, I'll just show you the properties. I've formed a table, so it is easy to learn from a table. So just going through. So first important property is excitability. That means they are capable of responding to a stimuli, whether it is electrical, chemical, mechanical. Okay? And they can produce local potentials. They follow all or none law. Action potentials will be evoked only with a threshold stimuli. If you give a subthreshold stimuli, you will just get a local, you will not get an action potential. They will not respond to a stimuli. And suprathreshold and threshold stimuli will produce same type of response. They show refractory period. That means application of two or more stimuli. When you give in quick succession, they are not going to respond to the second stimuli, right? So this refractory period actually ensures that there is only forward propagation of the nerve impulse. Okay? There is only a forward propagation of the nerve impulse. Then there is something which is called as accommodation. What is accommodation? Slowly rising current fail because the nerve gets adapted when you are giving a gradually increasing stimulus. What is the reason? When you give slowly rising, okay, when you give a slowly rising stimuli, the opening of the sodium channels is slowed down because there is opening of the sodium channels, but there also comes a time when there is closure of the inactivation gates, and at the same time you open up the potassium channels. So दो चीजें एक साथ हो रही है, सोडियम अंदर नहीं आ रहा है और potassium channels get opened, and because of these two conditions you are not getting the extent of sodiums which you should get for depolarization to take place. So you are reducing the extent of depolarization. Then the next is the conductivity. So the impulse spreads, but remember, intact nerve में there is only going to be unidirectional conduction. Action potentials will always propagate in the forward direction. Impulse conduction is going to be faster in the myelinated nerve fibers, that is called as saltatory conduction, and obviously it is going to be more as compared to be the non-myelinated. So remember, they increase in the diameter and they increase the membrane resistance and they decrease the membrane capacitance and increase the exoplasmic conduction, or they decrease the resistance across the exoplasm. Now let us consider what we called as the degeneration and the regeneration of the nerve fibers. And then we'll take this in the form of a table also. But first what we will try to understand first, and then we will take this in the form of a table. Because table is a summary, the way in which you should write to make the things easy to learn or to express. Now, the nerve injuries, they can be sometimes simply caused by pressure. Okay, simply they can be caused by pressure which results in excess of hypoxia. They can be caused by fracture, or there can be some kind of poisoning, okay, right, through and through injuries, and the nerves can be injured. Fracture of the bones is very common because fracture of the bones is going to result in the injury to the nerve fibers. Now you can classify them into different degrees. Okay, you can classify them into different degrees. So you classify them into 5 degrees. 5 degrees. The first one which we start is called as the first degree nerve injury. Now in this first degree nerve injury, there is simply a pressure, and that too for a short duration. Okay, there is a pressure and that too for a short duration. This pressure is going to result in what? This pressure is going to result in hypoxia. Okay, this pressure is going to result in hypoxia. Now there is a pressure which is for a very short duration. It is resulting in hypoxia. There is no anatomical disruption, no problem in the anatomy of the fiber. कुछ भी anatomical structure खराब नहीं हुआ है, and there is only a reversible loss of function. Right, there is only a reversible loss of function, and the nerve will recover completely. Complete recovery is seen. These are the simple ways the MCQ is asked. So complete recovery is seen in. So you must know first degree nerve injury, which is also called as neuropraxia. Neuropraxia, complete recovery. Neuropraxia, that means just within hours or up to days, there is going to be complete recovery. For example, crutch palsy. Okay, somebody who is walking with the help of crutch, and there is compression of the nerve fiber, or something very important is, which or very commonly is the Saturday night palsy. What is Saturday night palsy? Very commonly it is seen in the people who drink on weekends, and they sleep like this. That means hanging their hand over the chair, and they compress the nerve, and it is seen more commonly on weekends. So therefore it is called as a Saturday night palsy. Or even application of a very tight tourniquet. Okay? Application of a very tight tourniquet can also result in a Saturday night, can also result in this first degree nerve injury. But remember, this is very, very reversible. There is no anatomical disruption. Then the second is the second degree nerve injury. अब second degree nerve injury में the amount of pressure that is applied is more. ठीक है, इसमें क्या हुआ? The amount of pressure is more, so it can result in the death of some axons. But very importantly, you must remember, very, very importantly, that the endoneural tube is intact. It is not interrupted. Not interrupted. Okay, the endoneural tube is not interrupted. So second degree में pressure थोड़ा सा ज़्यादा हो गया, right? Death of the axons, but the endoneural tube is not interrupted. इसमें what next thing can occur be, there can be distal axon can degenerate. Distal axon, that means at the site of injury, suppose this is the axon. So at the site of injury, the axon will die. Okay, at the site of injury, the axon will die. But जो distal side में axon है, यहाँ पर there can be distal degenerative changes. There can be distal degenerative changes in the axon. Plus, there can be chromatolysis. What is chromatolysis? Remember, I started with the degeneration of the Nissel's granules. So proximal changes क्या हो जाते हैं? जो changes cell body में आते हैं. Distal changes क्या होते हैं? जो आपके axon में आते हैं, right? जो आपके axon में. तो यहाँ पर distal degenerative changes मिलेंगे हमको, और chromatolysis हमको मिल सकता है towards the cell body. And what is chromatolysis? It is the degeneration of the Nissel's granule. Now यहाँ पर regeneration will be taking place. So you will get that there is regeneration because there is intact endoneural tube. There is intact endoneural tube. So there will be regeneration which is going to be helped by the intact endoneural tube, and also there is going to be the regeneration of the myelin sheath. Okay, there is regeneration because you have got intact endoneural tube, and followed by this there also is going to be the regeneration of the myelin sheath. Then you have got first ho gaya, second ho gaya, which are not so grievous, but then you have got the grievous one, which are the third, fourth and the fifth degree of nerve injuries. Third, fourth and the fifth degree of nerve injuries. इसमें they are severe because यहाँ पर the endoneural tube is disrupted. This is the third वाला, ठीक है, this is the third वाला where the endoneural tube is disrupted. Fourth degree में you will see that even the nerve fascicles are disorganized. The nerve fascicles are disorganized. And fifth wala to is very, very severe. Fifth wala, through and through transection, okay, through and through, or the complete transection of the nerve trunk. Right, complete transection of the nerve trunk. So first degree एकदम reversible changes होते हैं, थोड़ा सा pressure and hypoxia. Second degree में some of the axons may die but no endoneural tube is disrupted. Third, fourth and fifth degree बहुत severe होते हैं, जिसमें कि third में you will get that there is disruption of the endoneural tube. Fourth में nerve fascicles disorganize हो जाएंगे, और fifth is very severe where there is transection of the nerve trunk. So this is the changes which take place. Now if you are asked, you know, what are the changes in the cell body, what are the changes in the distal degenerative changes, तो वो थोड़े से हमको short note के हिसाब से हमको पता होना चाहिए. So in the cell body, especially you consider the fifth one, which is the most grievous one. इसमें you're going to get the changes in the cell body. So first I'll just write down the degenerative changes in the cell body. Okay, so what are the degenerative changes in the cell body? सबसे important होता है या first step आता है आपका proximal cell body में within 48 hours. Okay, within 48 hours आपको दिखेगा that the Nissel's granules they disintegrate. That means chromatolysis. Okay, Nissel's granules they disintegrate. That means they lose also their staining properties. Okay, they lose their staining properties. The Nissel's granules disintegrate proximally in the cell body within 48 hours. Then the structures, that is your Golgi apparatus, it will degenerate, it will become fragmented. फिर आपके न्यूरोफिब्रिल्स जो थे वो भी are not visible. Not visible. The cells will become swollen. एकदम राउंड अपीयरेंस दिखने लग जाता है. एंड सबसे इंपॉर्टेंट आपका जो न्यूक्लियस है इट विल बिकम इसेंट्रिक इन पोजिशन, एंड फाइनली इट मे इवन बी रिमूव्ड आउट ऑफ द सेल. इट मे इवन बी एक्सट्रूडेड आउट ऑफ द सेल एंड द सेल डेथ विल टेक प्लेस. ठीक है, तो प्रॉक्सिमल में अगर आपको फर्स्ट चेंज बोला एमसीक्यू में तो इट इज क्रोमैटोलाइसिस, दैट इज डिसइंटीग्रेशन ऑफ द Nissel's granules. All the organelles will be removed, degenerated, disintegrated, neurofibrils नहीं दिख रहे हैं, cells swell up हो गया है, nucleus eccentric आ जाएगा, and finally extrude हो जाके cell की death हो जाएगी. Now what changes will be taken during regeneration? तो मैंने कैसे पढ़ाया आपको, proximal में degenerative changes क्या है और proximal में ही regenerative changes क्या है. So what are the regenerative changes that are going to take place on the proximal side during regeneration? Regeneration may start after 20 days, but it can even take up to 80 days to get completed, right? It is a slow process. And सबसे पहले you will see that the Nissel's granules, then the Golgi apparatus, they are restored, right? They are restored. Nucleus, again it will come into the central position if it is not extruded in those one, and the swelling of the cell will subside. Right? So जो बाहर चले गए थे वो सब अंदर आ गए. That kind of the changes will take place on the proximal side, that is on the cell body. Then what are the degenerative changes which take place in the nerve fiber? Now in the nerve fiber, remember the distal degenerative changes, only the distal degenerative changes are called as Wallerian degeneration. Only the distal degenerative changes, only the distal degenerative changes are called as Wallerian degeneration. This is MCQ. Okay, ये आपका MCQ है. Remember like this. The distal degenerative changes are called as Wallerian degeneration. तो distally क्या होगा? सबसे पहले the axon will break. Okay, the axon cylinder, it will break into segments. It will break into segments. Then myelin will, first axon will break, and then the myelin will also break into lipid droplets, or it will fragmentate into lipid droplets. और साथ साथ में जो ये whatever is getting accumulated, it will be scavenged also. The debris would be removed at the same time. And you will see that the Schwann cells, they start multiplying, so that they occupy the endoneural tube. Okay, so that they occupy the endoneural tube. And the role of the macrophages will take place, because the macrophages will start phagocyting these contents. Okay, they will start their process of phagocytosis. So distal degenerative में first changes, axon will break into fragments. Second changes, the myelin will get converted into the lipid droplets, and at the same time you are also going to start the scavenging of all these things, right? Now in the proximal side, what will take place in the proximal side? So we first saw the cell body, then the distal degenerative changes which are called as the Wallerian degeneration, and in the proximal stump, what are you going to get in the proximal stump? So in the proximal stump, you will see that the degenerative changes are similar. जो आपको distal में मिलता है वही आपको proximal में मिलता है. Similar to distal degenerative changes. Similar to distal changes, but only up to the nearest node of Renvir. But only up to the nearest node of Renvir. Right? Then what are the changes you will get at the site of injury? Right? What are the changes which you are going to get at the site of injury? So at the site of injury, you will see that the Schwann cells, it start giving its processes which are going to project from the distal stump. Schwann cells, it gives elongated processes. Elongated processes, and they project in various directions from the distal stump. From the distal stump, right? That means what you're going to do is, देखो यहाँ पर break है, this is a break which has been occurred. You're going to try to fill this gap, right? You're going to try to fill this gap. It is possible to bridge the gap only if it is up to 3 mm. Otherwise, a surgical correction will be required, right? You are able to bridge the gap only if it is up till 3 mm. Otherwise, you're going to require a surgical correction. Now, what changes you're going to get during regeneration? I will tell you the entire thing in the form of a table also, so that आपको लिखना easy हो जाएगा. So just understand this, और फिर हम लोग एक table देखते हैं, तो table के through आपको समझना easy हो जाएगा. Now regeneration में आप देखोगे कि the axon in the proximal stump, it starts growing. Okay, the axon in the proximal stump, it grows. मतलब it can give up to 100 fibers, right? It can give up to 100 fibers, so that they enter, guided by the endoneural tubes. Okay, they are going to be they enter the distal endoneural tubes, guided by the Schwann cells. Schwann cells, right? So this is the proximal end, this is the distal end. यहाँ पर it is giving the sprouting, axonal sprouting, and they are going to be guided by the Schwann cells, so that they go and fit into this distal stump, so that the gap which is created is now, I mean, sealed off. But remember, the gap can be sealed off only if it is 3 mm. 3 mm से यदि ज़्यादा होता है तो surgical correction लगती है. Now, although many of these, more than one fibril may enter the endoneural tube, only one of them is capable of surviving and ultimately going to fill the tube. Only one will survive and fill the endoneural tube. Endoneural tube, right? And finally, the myelin sheath regeneration. Myelin sheath का जो regeneration है, it starts within 2 weeks, right? The myelin sheath regeneration, it starts within 2 weeks, and it can continue. It may even take up to 1 year for it to be completed. So it is not so easy, okay? And remember that the diameter of the regenerated nerve fiber, okay, the diameter of the regenerated nerve fiber will always reach only 80% of original, right? The diameter of the regenerated nerve fiber will only reach 80% of the original. पूरा का पूरा जितना original था उतना कभी भी it is not going to achieve. And you must remember that this entire process of regeneration is going to be held by your growth factors. Growth factors. These growth factors will be secreted by the Schwann cells. Also, you will see that there will be role of neurotrophins, and also there will be role of some cell adhesion molecules, right? Cell adhesion molecules, right? Now, यहाँ पर बहुत important होता है जो आपका covering होती है nerve fiber की, जैसे जो perineurium होता है. This perineurium secretes certain inhibitory substances. Okay, it secretes certain inhibitory substances so that the axonal sprouting is in the correct way. So that the axonal sprouting is in the correct path or the correct way. कहीं इधर उधर नहीं जाना चाहिए, right? So you have got degenerative, regenerative changes proximal साइड पर, नर्व के इंजुरी के साइड पर और डिस्टल. लेकिन सिर्फ डिस्टल डिजेनरेटिव चेंजेस को आप बोलते हैं वोलेरियन डिजेनरेशन, बाकी नहीं. Now there can be certain complications. सबसे important तो क्या होता है, there can be a patch of anesthesia. That means the sensation over a particular area may be lost for some time or हमेशा के लिए भी, right? There can be also something which is called as misinterpretation इंटरप्रिटेशन ऑफ द सेंसेशंस. फॉर एग्जाम्पल, अगर टच का सेंसेशन दिया तो पेशेंट उसको इंटरप्रीट करेगा टेम्परेचर जैसे. और कभी कभी सबसे इंपॉर्टेंट कॉम्प्लिकेशन जो आ जाती है वो होता है न्यूरोमा, स्पेशली इफ द गैप इज मोर देन 3 सेंटीमीटर. Right, if the gap is more than 3 centimeter, there will be formation of an intermeshing painful collection of nerve fibers. Intermeshing painful collection of nerve fibers, which is called as neuroma. So there can be anesthesia, there can be misinterpretation of the sensations, and there can be a painful nerve collection, which is called as neuroma. Now what we'll do, we'll look this entire thing in the form of a table, so that आपके लिए the things become very very easy, because it is a big topic which is really difficult to write. Now see, one way of classification was the Sunderland classification, which was 1, 2, 3, 4 and 5th degree. Another way of classification is neuropraxia, axonotomesis and neuronotomesis. Neuronotomesis is going to be the 5th degree of Sunderland, where there is complete transection. Neuropraxia is the mildest form, where there is complete recovery possible. There is only hypoxia. There is no anatomical disruption. Remember, motor nerves are affected more by ischemia as compared to sensory. So endoneurium is intact, there is no problem, and there is complete recovery within hours to days, which is the 1st degree according to Sunderland's classification. Axonotomesis, moderate type of cause. Crush injury, it is very common with bone fractures. जब bone में fractures होते हैं, the kind of injury which is found is axonotomesis. There can be disruption of some axons. Endoneurium may show a lesion, but the perineurium is intact, and recovery is complete, but there is delay in the recovery. And this axonotomesis shows a very important recovery sign called as the Tinel's sign. What is Tinel's sign? There is tingling sensation. There is tingling sensation at the site where there is regeneration of the nerve fibers. Tingling sensation at the site where there is regeneration of the nerve fibers. Right? Neurotomesis is most severe, where usually there is no spontaneous recovery and a surgical intervention is required. All the layers are lesioned. The endoneural tube is not intact. There is complete disruption of the axons, fascicles. It is caused by very severe stretching, a complete transection of the nerve fiber. Right? So, I told you that there is Tinel's sign which will be present. Okay? Wallerian degeneration is present in axonotomesis. And there is something which is called as motor march. Motor march, which is present only in axonotomesis. That means once the nerve starts recovering, there is a progressive re-innervation of the affected muscles from proximal to distal. Okay, there is a progressive innervation of the affected muscles, and the direction will be from proximal to distal. Tinel's sign will be present in axonotomesis also. It will be present as well as in your neuropraxia. Motor march is present in your axonotomesis, right? So remember, full recovery is with neuropraxia and no recovery is with neurontomesis. And graphically you can see the nerve injuries. Okay, so these are the types of the nerve injuries. The changes which you will get in the proximal side, cell body पर आपको लिखना पड़ेगा, chromatolysis पर लिखना पड़ेगा, and fragmentation and disappearance of the organelles and nucleus. So proximal stump means towards the cell body. Distal stump means Wallerian degeneration, so right about the degeneration of the axon, about the myelin sheath, and साथ में there is going to be the process of phagocytosis, which will be started by the Schwann cells and by the macrophages, so that there is clearing of debris from the injured site. The regenerative changes will start in the proximal stump, okay, and they will continue or they will succeed only if the endoneural tube is intact. Therefore, regeneration is possible in neuropraxia. It is also possible in axonotomesis, but it is not seen with neurotomesis. Proximally, the cell bodies regain size, normal size. They were initially swollen, normal size. Appearance of the granules and the organelles. Nucleus will become central in position, and you will get this sprouting, proximal stump से you will get the sprouting, right? So that they gain entry towards the distal end into that endoneural tube, which will be guided by the Schwann cells. Distal, the endoneural tubes get ready to receive the fibrils which are coming from the proximal side. The Schwann cells keep on dividing within the endoneural tubes to form cord-like processes, and gradually the axons refill this endoneural tube, and the Schwanns, they are going to form the myelin sheath. And here you can see the strength duration curve. This red curve is of the normal nerve, and the blue curve is what is of the nerve injury. You can see that after the nerve injury, when you compare the strength duration curve of the injured nerve with that of the normal nerve, the Rio base is increased, the utilization time is increased, and the chronaxy is prolonged. You can draw this diagram, you know, your answer will become very, very effective when you are writing your answer. So it will become very effective. Rio base means the minimum strength of stimulus that is required to bring about response. So Rio base has increased. Utilization time means the time for which the current should be passed to produce a response. So utilization time bhi बढ़ गया है. Chronaxy is the measure of excitability. Lesser the chronaxy, more is the excitability. But if the chronaxy is prolonged, that means the excitability is reduced, right? So if you add on this diagram, right, if you add on this diagram, can you make a diagram of neuron? Okay, I'll try to add the mnemonics. I have, you know, yesterday's के lecture में जैसे properties of action potential में मैंने mnemonics डाल दिया था. Clinical वाला aspect मैंने multiple sclerosis की clinical history डाली हुई है. I have added multiple sclerosis का clinical history I have taken in the start of lecture. That is present in the start of lecture, right? अब हम लोग क्या करते हैं, just because you want a revision of this, तो I'll just take a revision of this. उसको हम लोग एक revision ले लेते हैं. पूरा structure of neuron कैसा है, like in the form of a story. So if you take a form of a physiological story of the neuron, you will see that this is the axon or the cell body, okay? Axon or the cell body, where there is going to be production of the graded potentials. These are going to be the branches or the dendrites which have got dendritic spines, and they are the receptor zones. Matlab those zones which are going to receive local potentials from the neighboring neurons, right? Inside this you have got Nissel's granules. Nissel's granules are rough endoplasmic reticulum which play a very, very important role in the synthesis of neurotransmitter, that is acetylcholine, and they are also called as tigroid bodies. The axon hillock, this conical portion is the axon hillock, और उसके बाद का जो first part है जहां पर there is no myelin sheath, इसको हम लोग बोलते हैं initial segment. ये जगह पर you will get that there is no Nissel's granule, but these are the site of generation of propagated action potential. मतलब जो action potential अभी propagate होके आगे जाने वाला है वो वहां पे produce होते हैं. The role of the axon is conduction, Okay, conduction or the propagation of impulse, and the conduction velocity will depend whether they are myelinated or they are non-myelinated. They are going to end in the form of synaptic knobs which contain the secretory vesicles which contain the neurotransmitter, that is acetylcholine, right? So the structure of neuron अगर एग्जाम में आता है ना, तो you write the structure of neuron और बाजू में ही आप उसके functions लिख दो, आपका टाइम भी बचेगा और आंसर बहुत सिस्टमैटिक दिखेगा, राइट? फ्रॉम टुमारो नहीं, टुमारो नहीं, माय नेक्स्ट लेक्चर में आई एम गोइंग टू स्टार्ट वेरी वेरी इंपॉर्टेंट टॉपिक, that is neuromuscular junction, because this is the topic where you are going to get clinical case based scenario. You're going to get a clinical case based scenario from this, right? So I hope all is okay and all are good. You've got this lecture nicely. Structure of neuron is important, nerve fiber का classification is important, properties of nerve fiber वाइवा में भी पूछते हैं, और एक्सपेरिमेंटल लैब में जो आपको ग्राफ दिखा रहे हैं ना स्केलेटल के और उसके, उसमें भी इसको पूछ लेते हैं, राइट? सो जो वोलेरियन डिजेनरेशन पे यूजुअली शॉर्ट नोट आता है, वोलेरियन डिजेनरेशन, तो वो थोड़ा सा हम लोगों को देख लेना चाहिए, right? Wallerian degeneration, but distal degenerative changes which are called as Wallerian degeneration is a short note which is asked, right? Now one thing यहाँ पर एक थोड़ा सा हम लोग add कर लेते हैं, peripheral neuropathy is very common. The causes which is important from viva point of view: nerve injuries, diabetes, vitamin B12 deficiency, infections like HIV, leprosy, and conditions that can occlude the blood supply to nerve like atherosclerosis and vasculitis. So this causes of peripheral neuropathy you can add wherever you have got a question or an answer related to it, just to enhance the beauty of your answer, right? उसको बढ़ाने के लिए आप ये कर सकते हैं. So thank you everyone and good evening, nahi abhi good night, and always let it be a happy learning. Keep on putting your comments so that I can get a feedback and I can also come to know what exactly is needed by you people to study and where are you facing difficulty. So thank you and God bless you all.